Well, I wanted to start by maybe telling you a little bit about what to expect from our care today. Um, have you seen a therapist for a medical assessment before?
Um, I haven't not for the I've seen a I saw a therapist for a little while so I could get on hormones,
Mm-hmm, mm-hmm.
but not for anything except. I did see a therapist for a medical assessment in relation to trying to get on disability,
Uh-huh.
which I'm still going through trying to do that.
Yes.
But
Oh God, that's a huge feat, isn't it? Yeah. Okay. Well, there's a million therapists out there, and they're all practicing in different ways. So I thought I could start by just sharing with you how I practice and what you can expect from me today. Um, I've been doing this care with folks for like 4 years now, and I've worked with about hundreds of people who are moving forward on medical procedures. Um, and as I've been wrestling that stuff about why do you even need to see a therapist before medical care, um, and the requirements for that. I mean, I think it's a huge gate too, and I don't think that you should have to do it. Um, but since insurance still requires it, my question to myself was like, how can I be useful to you? And so, what I really value in this time is this is not about you proving it to me. This is not about you having to tell me the right story, and telling me your whole history. This is about really looking at your steps ahead and the next parts in the process so that you feel like you have the information in order to move ahead. Um, so I honestly, I don't say no. I say how. And so by the end of this session, we'll get you referred for your care. Um, and at the end of our session, we'll kind of have a plan together of how you want to move forward. Some people want to see me again, maybe down the road, for additional planning and such. Other people are like, I got it, I'm solid, and they never see me again. Other folks are looking for a therapist to work with ongoing, and right at this very moment in my schedule, I'm so packed. And I'm not taking new clients, but I do prioritize seeing folks that I've already seen. So, say in a few months, if you're like, hey, it was awesome, and I want to go back and work on some stuff, feel free to look me up, and we'll see what we can do. So, I also have a good list of people who could see you if you did need somebody to work with right away. Yeah. This is the really fun part, by the way, where you just get to listen to me talk at you. Everybody loves this part. But some of the other pieces about working with me in this kind of setting, this does create a health record, and the letter is part of your health record. What I guarantee you is I hold on to this letter for like 10 years. And say a year down the road, 4 years down the road, whatever it is, you're like, I'd like to move forward on this other procedure that needs a letter. I will still have the letter. And all you have to do is like call me up. We update, we talk about where your life is at right now, and make sure you feel prepared for that procedure, and I'll get you that updated letter. So it's not like having to sit down and do the whole process again. Fair? Okay, cool. Other little pieces about working with me. Because I am working with your insurance, there are a few things that they require me to do. One of which is give you a diagnosis. And when talking about gender dysphoria, like, it's kind of a problematic diagnosis, I think. It doesn't fit everybody. Not everybody is dysphoric, but they still need the care. And I also know it's a very intimate conversation. So as we discuss why you need this care, it can be as brief as, hey, do you experience gender dysphoria? And you're like, yes, and that's all I need. You don't have to go into a long, detailed story about it. You don't have to talk to me about everything. Okay? Just that's my guarantee Because you have all of your information updated, I won't even say old names. I won't even say old genders on your paperwork, because why do I need to? And I'll use language that you use to refer to you in my paperwork, so that hopefully it's as affirming as possible. I do like to give you the letter before I send it on, so that you can like just go through it and make sure I have all of your information correct. But you can also tell me, this is not how I talk about myself. I don't want this said about my experience. You can tell me all sorts of things, and I'll revise that letter so it fits in. And then I fax it to your doctor for you, so you don't have to do the paperworky parts. And then they get you rolling. So that's what to expect